Let me introduce you Anna, one of my first cancer patients that needed chemotherapy for her breast cancer. And she felt very alone and depressed. Because the problem is that doctors don't really have the time for patients to help them one by one. Supports like personalization, and patients feel lost in their journey. So this is why our team created Hilo Health, an online platform in an application format where we help patients by providing a patient journey where they can see step by step what's going on in their life. We also provide daily suggestions where if they give us data, we can make it very personalized and for them. And also community support that they can connect to other similar patients and ask them questions for guidance. We already have created a prototype, and actually 1 in 5 people in their life will develop cancer, which is a huge number and is increasing every day. And as for our business model, we identified a B2B business model where we would like to have partnerships with pharmaceutical companies, and we can provide them real-world data. And we also have a B2C model where we offer a freemium plan and for subscription extras. As for our market size, I would like to emphasize our serviceable available market, which is 400 to 400 million euros per year. And as for our financials, we identified that from pharmaceutical companies, around 1 to 3 million forints per month would be available. And for our basic plan, we could charge some fee from the patients as well, but it would be lower. And as for our competitors, I would highlight Prosoma, which has raised 4.4 million euros in funding recently, showing that there is indeed need in the market. As for our team, we have diverse range of background from engineer, front-end development, healthcare, and also finance and business. As for our roadmap, first we now have our initial prototype, and in the second stage we want to refine this prototype and have the clinical testing. Actually, the National Institute of Oncology has already reached out to us, and in our next stage we will start partnership with them and do clinical trials. And this is the right time to help us. We would like to ask for 6 to 10 million forint as an investment for our stage 2 trials, and also for partnerships and mentoring in order to have more partners. And thank you so much for your attention.
Thank you for the presentation and for your timing. And now I turn to the jury to ask their questions.
Okay, for the final time today, what can you tell us about your market and your competitors? So what do they focus on right now? What trends do you see? And how do you see your position on the market?
Yes, thank you so much for your question. So as for our market, we have identified 2 main spectrums that are like pretty highlighted. One is about personalization. So how basically generic the information is that a certain app provides to patients. And the real problem is that most of our competitors just bump us with generic information. They don't really use any up-to-date technology. So our app is based on very up-to-date technology like machine learning that makes us unique, and we can provide very specific information that the patient needs. And the other aspect is about the comprehensive approach. So there is the ERAS protocol that Hungary has already so far started to adapt, which is basically about how multidisciplinary something is, meaning they focus not just on psychology, for example, or diet, nutrition, but we try to focus on all these 3 aspects, so diet, nutrition, and also physiology, so exercise. So that's how we stand out, because we pay attention in both of these spectrums, whereas our competitors usually just focus on psychology or they lack personalization.
In your presentation, you mentioned that you would share some of the data that you collect with pharmaceutical companies. Aren't you worried about some of the GDPR rules and anything that comes with that, especially in the healthcare sector?
It won't stop us for sure. Of course, we are aware of GDPR regulations and are sort of prepared for it. What we want to do is that we kind of provide the so-called soft data and not the most sensitive data, and we would already process some of those data. Since more of us have research background, we would provide the data that's already processed and show the meaning of it, and of course it would be anonymous. We have already started the legal procedures and talk with lawyers about this, and so far it seems to be smooth. Of course, we are aware that it's not going to be a very easy journey, but we are well prepared for this.
Thank you for the presentation. I have a question regarding the content that will be available on the platform. So you mentioned that you are trying to leverage AI as well and trying to be as unique as possible. But I think currently, in order to provide medical information or medical guidelines to patients, you have to be a licensed doctor, or at least a licensed doctor have to review the content that you are publishing in your platform. Do you have doctors in your team, or how are you planning to tackle this problem?
So I came from research background, working with doctors and with cancer patients, and there is one more person who has similar background. Right now, we don't directly have a doctor in our team, but the National Institute of Oncology reached out to us to collaborate, and they do have the protocols that we would like to use, and we can indeed elaborate in our platform. That's why further partnerships are needed, because we do not want to just rely on one partner, but now we are reaching out, especially in the Nordic countries like Denmark and Finland, where we also have some connections, and we would like to build more partnerships. And in these countries, also the market and open-mindedness is pretty good. So we have those in mind as well.
Thank you.
Thank you.